everyone. I'm Jacob Lang, and welcome to a special episode of the Mod Pod. This is the second installment of our new 2025 Empower series aimed at advancing optometric knowledge to help elevate our practices and our patient care. Today's episode will specifically focus on optimizing contact lens wear. Really honored to be here with our experts, Dr. Ashley Tucker and Dr. Jessica Yu. Thanks for joining me. We really appreciate having you on Empower.
Hey everyone. So yes, I'm Dr. Ashley Tucker. I'm so honored to be here as part of this wonderful podcast. My practice is Bel Air Family Eye Care down in Houston, Texas.
Hi, everyone. I'm so glad to be here with you all today. My practice is Connecticut Contact Lens Institute. We're in the southwest corner of Connecticut in Fairfield County, and I specialize in all types of contact lens fits and keratoconus specialty lenses, as well as myopia management.
Obviously renowned contact lens expert. So really honored to have you here. Do you guys wear contacts? Ashley, do you wear contacts?
Oh my gosh, yes. So I'm a specialty contact lens fitter. So I wear all specialty designs. And my favorite one though is a hybrid, which I know is the underdog for many specialty contact lens fitters out there. But I love a hybrid lens. I am mostly still, so it neutralizes my cylinder perfectly without having to worry about the rotation aspect. So I'm a big proponent of this lens.
And you'll actually like switch. You're like, oh, I'm gonna wear sclerals today, and then
Yes, depending on
oh
what I
wow,
do. Yes, so sometimes I will wear a scleral, like if I'm watching my daughter play volleyball and I want laser sharp vision, my
ooh.
scleral is amazing. If I'm, on vacation, I'll wear a daily disposable that I'll kind of deal with a little bit of rotation, but it's still quite good vision. But the best of every world is my hybrid.
That's awesome. That's really interesting. You like play in the field here with all the
I know,
contacts.
I'm an equal opportunist.
Yeah, Jessica, how about you? Do you wear contacts?
I do, yeah. I actually wear daily disposables. I'm also a lot of SIL, but more myopia. So I like to test everything on the market. I've tried pretty much everything out there, but my go-to is still a daily disposable soft toric lens. But I'm glad to hear Ashley say what she did about the hybrid. It's amazing because not enough people promote and advocate for the hybrid lens, and it is an underdog out there for sure.
So that kind of leads us into the next part of this, knowing your options, right? So choosing the right lens and the right fit for our patients. So knowing our options, let's talk about materials, like silicone hydrogel versus standard hydrogel, the high versus just high. If we think back of, years ago and still in pediatric practices, we had those Silsofts, right, by Bausch, I think it was, and still is, where they were like 100% silicone, and they kind of got away from that, moved into hydrogels, and then back to silicone hydrogels. Where are we at now? And when do you think about silicone in your lens? And when do you say like this is not a patient that should be dealing with silicone?
Hydrogel lenses are hydrophilic. They're well known for being made of polymers that love water, and they rely on water to transmit oxygen. But with that, the lens tends to dehydrate over time. So, when I was in school, we were taught that hydrogel lenses are where it's at for patients that have dry eye. But that, like I said, that lens tends to dehydrate. And where do you think it's getting the rehydration from? It's from our tear layer.
Right.
So silicone hydrogels, on the other hand, are made of silicone, and they don't require a ton of water to have a good oxygen transmission. There's more silicone, less water, so it doesn't really depend on our tear layer to rehydrate. So I tend to lean on SiHys in practice for the most part. I only steer clear of them when the patient has a known silicone allergy, or I've put them in a SiHy and they're having some sort of weird reaction. So that's where I'm at material wise. What about you, Dr. Yu?
I would agree with you, actually. I think that I definitely lean into the high category, but not forgetting the hydrogels as well. I think sometimes they do get bashed upon a little bit just because of their lower oxygen transmissibility and what we know about the benefits of oxygen and health to the eye. But I definitely lean into the silicone hydrogels as well. And I think that for most people who are not sensitive, they can offer such a great benefit for corneal health as well as just comfort. And it's been a really nice advancement in all of the different modalities for contacts for us.
Jessica, Talk to me about like daily disposable versus reusable lenses, kind of that wear schedule, where your mind goes with programming. What are your thoughts now with extended wear in contact lenses?
Well, I don't fit a lot of extended wear or reusable lenses. So my practice is probably about 95% daily disposables. So I definitely promote that. And just as far as like a fit strategy, that's the way I'm introducing contact lenses to most patients, especially children, teenagers, even new wearers, because a lot of the new technology is in that realm of contact lenses.
Why have you evolved? Like, why? I assume it wasn't maybe always 95+%, but why did you evolve towards that? Or what was the journey to get to that point?
I think it's just the convenience and also the health benefits of it. You know, when I graduated from school, we were, it was still the era of pure vision, night and day, and even like the older yearly hydrogel lenses. But over time, the increased replaceability of lenses has really just made contact lens wear such a nice convenience for patients, and also offering the health benefits, but also saying, lenses get dirty, they rip, they get makeup on them. People just have a little bit of a hard time maintaining that pristine surface for X amount of months. So having a more reusable lens just makes more sense. It makes travel so much easier, like what Ashley was saying. So it just makes sense as far as all that, provided that the economics make sense for the patient as well, of course.
Yeah, so you really feel like it's the best option for your patients is really the best way to set them up for success. Ashley, are there any patients where you're like, oh, I need to do something different? Or that maybe I would talk about extended wear and these certain patient types, certain patient lifestyles?
I do want to reiterate, I'm with Jessica. That is daily disposable are my go-to. That's what I open the conversation with, that this is the best option. But yes, realistically speaking, there are going to be people that are going to push back on daily disposables. The biggest thing is cost, unfortunately. That can be prohibitive for some patients. And then the other big issue is waste. Patients nowadays are very conscientious of plastic waste and how that impacts the environment. So the way to mitigate that is to have patients recycle their blister packs, their lenses, and the little boxes that they come into. There are plenty of programs that will recycle. We actually ask patients to bring in all of their waste to us and we recycle it for them. That's one thing. And then you have patients that are just not going to be adherent to our recommendations for disposability. If they're going to sleep in lenses, even though we're telling them not to, if they're going to reuse their daily disposables for a week or 2 weeks or for, God forbid, a month, I then will talk about extended wear, but that is very, very reluctantly. That's last resort after educating ad nauseum.
It's good to keep options in mind and realize not everyone's going to fit into the mold, but it's nice to hear that, if you talk about like good, better, best, you're saying best is daily disposable, better is daily disposable, and good, well, then we'll talk about it. So in how about our dry eye patients, especially like meibomian gland disease being, a very prominent form of dry eye, 80 some percentage of patients having some form of meibomian gland dysfunction in their pathology with our dry eye disease patients. How do contact lenses interact with our meibomian glands, with our eyelids, with our ocular surface?
A contact lens, even though we all love them, they disrupt the tear layer. They bisect the tear layer. There's going to be a post tear film, post lens tear film, and then a pre lens tear film. So it's disruptive. So we have to be cognizant that if a patient already has dry eye issues or already has MGD issues, this could potentially exacerbate that. So the best way to get around having a patient have worsening symptoms is to address these issues ahead of time. So I rarely ever will start a patient on contact lenses if there is any compromise to their ocular surface. So we need to be cognizant of that, and we need to let patients know that we're taking this as a stepwise approach and not just jumping 2 feet into a contact fitting prior to mitigating some of these issues.
Yeah, of course. I think that for sure, patient education is one of the most important pieces we can do as their eye care providers. And a lot of times I think patients love hearing this, right? Like they may not want to hear like a 10-minute spiel about their meibomian glands, but of course, if we're providing them a stepwise function of say, hey, you got to do warm compresses 3, 4 times a week. You have to do a little bit of lid hygiene. We know you want to succeed in the contact lenses as much as we want to see you succeed as your doctor, but it's going to require a little bit of TLC to be able to get to that point just because of your underlying issues. And I think if we sort of outline this for them and make it easy and present it in a way that's manageable, that it can make a lot of sense and it will improve their success rate and also keep their vision stable, especially in multifocals, which the optics really require that kind of nice surface for it to happen.
That's a great point. Like these presbyopic patients are at much higher risk for ocular surface disease, and we're trying to put them into a complicated, or at least higher and more advanced optic lens. If we don't support that higher level optics, we're gonna fail. And I think that was great, Ashley, about addressing ocular surface disease on the front end. We talk so much about that in preoperative care, right? Before LASIK, before cataract surgery, address the ocular surface, get better biometry. And so it'd be really interesting, I think we see that in contact lenses as well, right? We're going to get better, keratometry readings, better corneal topography if we're addressing the ocular surface on the front end. The other big thing that I think about is like messing with your eyes all day, right? So are we washing our hands? Are we getting all the soap off? Are we putting soap in our eyes? And the chemicals in, you guys kind of already beat it to the punch by like going to daily disposables, but the chemicals in solutions, especially more generic solutions, might be pro-inflammatory. I mean, anything that can be causing inflammation, whether it be makeup or contact lens solution, is probably going to drive that ocular surface disease and make our patients less comfortable in their lenses. So great to educate, like you said, Jessica, on all these things and the consequences of everything that you're putting in your eye. Awesome. I'm gonna get off my ocular surface disease soapbox here now. Um, but on the same thread here, let's talk about dropout and complications. So like why do patients stop putting in their contacts, and why do we not let patients put their contacts in? So why do we say, hey, you can't wear your contacts even though the patient might want to, and vice versa? When do the patients come back to us and they're like, oh, I don't see, we're not doing a contact lens check today, what happened? So what are the things you see causing that, and then what are your strategies for addressing those things?
Sure. Yeah. I always like to understand during my patient history portion of the exam why the patient, well, if the patient is wearing the lenses as much as I think they are, or as much as I last saw them wearing. And if they're not, then usually to understand why. So, is it the vision part of it stopping them? Are they not getting every piece of the vision that they want for their daily needs? Or is it something stopping them more like comfort? The lens is drying out, or they feel like they have to put in drops, or if they're just feeling like, the lens isn't staying comfortable in my eye for more than 5, 6 hours, and it's annoying to have to stop what I'm doing at work and just have to take them out and then put on my glasses, right? Because as much as we hate to admit, we're all human beings that love convenience and love ease. And so if something interrupts our flow, we're not as likely to do it. So depending what the response is, usually I'll target the exam a little bit, kind of gearing it towards that direction and trying to understand and see if I can figure out the underlying issue. And if so, then of course they're a great candidate for either like a refit for a contact, if it's something that's material driven or comfort driven or convenience driven. And of course, with cost, there's different strategies we can discuss with patients. Are they social wearers, part-time wearers? Are they taking advantage of rebates? Are there things that we can help to mitigate so that we can enhance their contact lens wearing experience?
Yeah, and by that enhance their quality of life, right? So that's
Exactly.
great. Yeah, good to be open, like it's okay for patients to tell us the reason why, right? And sometimes they're a little hesitant too for multiple reasons.
I would just like to mention, and this happens to me, unfortunately, more often than I would like, is that, fit a patient in a contact lens 1 year, and then, I see them back for their annual follow up on, why they aren't coming in wearing contact lenses today, and they'll mention, well, you fit me last year and I didn't particularly like that lens for some reason or another, and they're not understanding the fact that the fitting includes follow-up. And I'm committed, and so to get them to a point where they can wear contact lenses comfortably. But patients have this, they don't want to disappoint you. They don't want to tell somebody in your office or you that they failed, or they don't want to be a reflection of your relationship with them. So I love to make sure patients know during the fitting process that I'm committed. I want them to come back if there's any issues. So just the importance of follow-up care. I just want to make sure our listeners know that, patients don't necessarily understand that contact lens fitting isn't a one and done sort of effort.
Yeah. Yeah. I'm here for you. That's awesome. What about complications? Like, what sort of things do you see where you're like, oh, I'm a little worried about things. Let's delve into your habits or your wear schedule, or we need to pivot on this lens. What sort of complications have you been seeing? Lots of, fungal keratitis and acanthamoeba, or maybe something a little more common.
Yeah. Thankfully, I don't see that very frequently. The biggest thing, especially here in the South, is just allergies, allergens just being such a problematic issue. And that is actually a good selling point for daily disposables. I have lots of patients that I've been working for a while trying to get them into a daily disposable. So it's a very easy conversation. They come in with itchy eyes, not being able to wear their lenses for as long as they would like. And the solution for a lot of these patients is just to simply switch them to a daily disposable. So I would say allergies right now, and the complications from that are the biggest thing that I see on a regular basis.
Yeah, we've had a bad allergy season here. So I'm with Ashley on that one. The allergies definitely play a significant role for us, like come spring and fall. Another big thing that I tend to see is people who just, I think not intentionally per se, but just by ease of use, is that they get a little cavalier about their habits, right? Like maybe the solution they're using, they're starting to drift towards generic or something less compatible because it just may be a little bit less expensive or it's a little easier to find, or people who might start developing a little bit of bad habits with their contacts. And we find that they can sometimes get some problems from it, from contact lens, not so much true abuse, but like a little bit of that and also just misuse of them, right? Those uncertain moments they have where the eye's a little irritated, but they might just persist in wearing that contact a few extra hours or an extra day or two. And it does end up causing them, a few days of problems, whether it's an abrasion, an infection, an infiltrate. And so that's, sort of re-educating patients who have been in contact lenses for decades that these regular, simple habits of hygiene are super important.
Yeah, yeah, especially college kids. I see sometimes, college kids sometimes live a rowdy lifestyle, and with that lifestyle comes some rowdy complications. The other thing, do you guys think like allergies? Do you feel like more patients have more allergies than we did like 5, 10 years ago, or is it just that we blame everything on allergies more? We understand how much stuff is in the air and how much of a role, where we used to maybe put up with it.
Gosh, I sure feel like it is. I have never been an allergy person myself, and I'm having trouble this season. So that's a great question, Jake. I don't know to that. I don't know the answer to that, but it sure feels like I'm seeing more allergic responses just to the environment than I ever have.
Yeah, I feel like I see a lot more kids and teenagers with allergies than I remember when I was a kid or teenager. And friends, like it didn't used to be a thing, so to speak. And now it's very common, people getting allergy shots and going through these different issues with their allergies.
Yeah, probably enough for a whole nother podcast, but presbyopia. It's not my favorite word these days, as the birthday candles on my cake are increasing. But are you guys each team multifocal or team monovision, or is there a place for both? And if so, when are you like, oh yeah, this is an ideal multifocal patient, this is an ideal monovision patient? Jessica, what do you think?
Well, I'm more team multifocal. I'm probably like 85% multifocal, lesser percentage monovision. I do think monovision has its place. That being said, I feel like for some people, their brain is just wired in such a way that they process monovision better. They can deal with that separation and that sort of combination using their binocular vision. But at the same time, I do advocate for multifocals because that's having that binocularity and having both eyes have that more or less equal distance, intermediate and close vision just brings so much more to the table. And I really do think technology for multifocals has come a very long way since I first started seeing them. So
100% agree. Team multifocal all the way. But, of course, monovision has a place, especially in our emmetropic, presbyopic patients. That's where I lean on monovision the most. And just maybe on people that just don't have really significant near demands, like someone that has a more active day to day, that, they're not staring at a computer all day long and they're not at a fixed distance. I lean on monovision for that, but I love binocularity. I think we were born that way, so I want to capitalize on that in every aspect of eye care. So multifocals whenever possible.
Yeah, I think of it like in monovision, you're trying to suppress one eye. You're either suppressing the distance eye or the reading eye. You're suppressing. Whereas in multifocal, you're trying to enhance or to fuse or to build upon each other. I kind of agree with you. Like binocularity is a thing. There's a reason we have stereopsis and binocularity, and why do we want to poke that bear, so to speak, or take that away from patients? So I agree wholeheartedly. So
For those of us that wear contact lenses, we don't want to stop wearing them. So as a contact lens wearer myself, I am trying to create new options for myself as I am becoming presbyopic. And so I understand the struggle that, I've been talking to my patients about for years and years, but I don't want to come out of contact lenses. I want my doctor to figure out a way to keep me in them. So we need to do that for our patients, just put ourselves in their positions and understand that it's a big shift to go from contact lenses to glasses. As a younger doctor, I took that for granted, but now I realize that we need to do all that we can within our power to keep our patients in them for their own happiness and for our practice to maintain those patients and maintain the revenue, because that contact lens patients also need glasses. So that's another aspect of contact lens retention that is really helpful to the practice sustainability.
I think that it's important for us to always showcase the technology that's been made available to us, emphasize the importance of the fitting process for contacts and why we're doing what we're doing, why we're selecting and fitting a patient with a specific lens, communicating with and educating them about these different finer points, because ultimately they generate more successful fits, which will generate referrals for the practice and ultimately growth for
yeah.
us.
Yeah, word of mouth is powerful. I see that in my practice a lot, that I'm seeing a lot of, oh, my sister told me I had to come see you, or my neighbor, or I'm a nurse and the nurses on my floor told me I got to come see you. So word of mouth is probably underestimated. I think that we realize that when people are, especially when people are happy and they're doing better, their friends recognize it, like, hey, your eyes look so much happier, or why aren't you wearing your glasses? So there's people notice these things, and when they get noticed, they get recognized. So awesome thoughts. Again, in summary, we talked about daily disposable, multifocality, being there for your patients, connecting with your patients, asking questions about why they're not wearing lenses, or would you like to wear contact lenses? Is there an opportunity for you to be a contact lens wearer? Let's wrap up with one kind of golden ticket. If you could give one piece of advice to the listeners, to make them a better, more successful optometrist with regards to contacts, what would it be? And then we'll wrap it up. So what's your golden ticket to the optometrist listeners?
I would say to really try to, and I know we all do this so well, but to really listen to what the patient is trying to tell us and really take that into account as we're trying to prescribe whatever it is we're prescribing. It could apply to glasses, but obviously in the contact lens world, no one contact lens works for everybody. And there's a lot of different strategies to make a patient happy. And the communication portion is so important to really let them know that why we're doing what we're doing and how we're trying to solve their needs.
Beautiful. Eye doctors need to have big ears. Is that what I'm hearing?
Exactly, exactly.
I would say go that extra mile for your patient. If they need a toric lens, fit a toric. Don't fit spherical equivalent. If you know in your heart that binocularity with a multifocal would be better for the patient, put them in a multifocal. Don't go the easy route, which I consider monovision. Just take a moment and put yourself in the patient's position and give them what you would want as the consumer, as the patient. So go that extra mile, take a little bit of extra time to fulfill their requests and their needs.
Yeah, there's no shortcuts to success, is there? There are no shortcuts to success. I love it. I love it. Well, awesome. Thank you, Doctors Yu and Dr. Tucker, for such a wonderful, complete discussion. Again, I'm Dr. Jacob Lang, and thank you for listening to the special episode of the Mod Pod. Please stay tuned for another installment of the Empower series coming your way soon.